So my name's Chris Plishka, and I'm the Methods Platform Facilitator at the Saskatchewan Centre for Patient-Oriented Research, or SCPOR, which is Saskatchewan's support unit under the Canadian Institutes for Health Research, or CHR's strategy for patient-oriented research. I'm very excited to be here today to discuss SCPOR's Patient-Oriented Research Learning Health System project call. This is the first year we're doing the project call, and we're looking forward to supporting some projects in the area of mental health and addictions. A note to ensure that everything works with Zoom. Please mute yourself if you haven't already been muted, and turn off your camera to help ensure we don't run into bandwidth issues. If you have any questions or connection issues, please type them into the chat box, and a SCPOR staff member will assist you with that. Also note that today's session will be recorded. If that's going to cause issues for anyone, then please message Maria Cruz in the chat, and she'll help ensure that we're able to remove you from the recording or find another workaround. So to start with, I'd like to take this opportunity to acknowledge that the event today is being hosted from Saskatoon, Saskatchewan, which is located on Treaty 6 territory. Treaty 6 territory is the traditional territory of numerous First Nations, including the Cree, Anishinaabe, Nakota, Lakota, and Dakota peoples. Treaty 6 territory is also the homeland of the Métis people. Personally, my ancestors came to this area from Ukraine around 120 years ago. In coming to Canada, they escaped discrimination, oppression, and genocide. However, I acknowledge that as settlers on this land, their presence contributed to the oppression and genocide of Indigenous peoples. As someone with settler ancestors, I've started to look for ways to integrate reconciliation into my day-to-day activities. And one small way I'm doing this is by engaging with more Indigenous art. One of my favorite groups right now is a Cree and Métis duo called Burnstick. So if you're looking for new music to check out, then I would highly recommend giving them a listen. Our session today will start with a welcome from SCPOR's Scientific Director, Dr. Malcolm King. After that, we'll move into some informational videos. We'll hear from one of our patient partners about their experience working to develop a project application as part of a research team. I'll provide an overview of the project timeline, and then we'll open the session up for questions to ensure that everyone has the information they need to get an expression of interest submitted if they're interested in doing that. I'll turn it over to Malcolm if he's made it here, but I don't know if he's got here yet. Malcolm, if you're here, just unmute yourself and I'll turn it over to you. All right, I know Malcolm's quite busy with a number of things right now, so maybe we'll jump to the informational videos. So I'll share those and then we can come back to Malcolm after we complete those. So if you give me a second here, then I'll share my screen and we can get started with the videos.
What is the SCPOR Learning Health System project? Well, what is a learning health system?
A learning health system is designed to make improvements to the health system in two key ways. First, by bringing together key stakeholders to increase health system efficiency, and second, by encouraging stakeholders to work together to form improvement cycles. Key stakeholders included in a learning health system or learning health system project include patient partners, which includes family members and community members, clinicians or care providers, such as doctors, nurses, and pharmacists, decision makers, such as healthcare administrators, elected officials, band council members, and representatives from non-government organizations, health system representatives, which includes anyone working within the health system, such as policymakers, as well as staff like quality improvement personnel and research scientists. And finally, academic researchers, such as researchers from the University of Saskatchewan, University of Regina, First Nations University of Canada, and Saskatchewan Polytechnic.
The three phases of a learning health system. Practice to data, where data about healthcare is collected from providers, patients, and the system. Data to knowledge, where people work to understand data and find areas for improvement. Knowledge to practice, where understandings are used to improve the health system.
There are a number of advantages to a learning health system. These include the ideas that rather than engaging patients as research participants, patient partners are engaged through all aspects of the project. Rather than interventions or implementation of interventions being suggested to the health system by researchers, the health system is involved in research, which makes it easier to implement. Rather than research ideas and projects coming from outside the health system, researchers work within the health system to address system priorities. Rather than data being collected by individuals from outside the health system, that data is automatically collected by the health system. And Rather than going through a lengthy or difficult process to get access to data, that data is accessible to providers and patients.
SCPOR supports include SCPOR staff with expertise in the areas needed to complete the project, like research scientists, data analysts, project managers. Each team can request the equivalent of 4 full-time employees to join their team and contribute their expertise to the project. Value of SCPOR supports. This in-kind support is valued at approximately $900,000 over 2 years. Teams will also be able to access up to $60,000 of trainee support and $10,000 in monetary funding over a 2-year period.
SCPOR supports also include access to data sets and information around data collection methodologies, as well as support to use these data sets and collection methodologies, support to engage patient partners and communities, and financial support and facilitation help for team meetings.
SCPOR supports include training opportunities for teams and individuals, building research relationships with First Nations, Métis and Inuit communities, budgeting and facilitating meetings, understanding research processes and how everyone can engage in them, and more. All projects will include the collection of PROMs and PREMs, so projects will support the improvement of patient outcomes and experiences.
PROMs are patient-reported outcome measures. These are self-reported measurement instruments that patients complete to provide information on aspects of their health. PROMs include areas that may impact an individual's quality of life. This information is used to provide insight into the effectiveness of care. For example, it could include symptoms, functioning capacity, physical, mental, and social health. PRIMs are patient-reported experience measures. These are self-reported measurement instruments or questionnaires that patients complete to provide information about their satisfaction with and experience of receiving healthcare. PRIMs focus on the process of care and how they impact the patient's perception of their experience. PRIMs are usually used to evaluate and monitor service quality. So that was a short introduction to the SCPOR's learning health system processes. The first step in our learning health system is going to be submitting an expression of interest. So we also created a video providing a little bit of information about the expression of interest process. So I'll share that as well.
Saskatchewan Centre for Patient-Oriented Research, Patient-Oriented Research Learning Health System Project, Expression of Interest Guide video. Thinking about submitting an expression of interest? Well, here is what you'll need. An application guide, a device to complete your application, and a research idea that aligns with the project priority area.
At this point, you only need one person to be the principal investigator, but you can have up to 3 other people join you in submitting your expression of interest for a total of 4 co-principal investigators.
Who can be a co-principal investigator? Patient partner. This could be the patient themselves, a family member, other informal caregiver, or a community member. Clinician or healthcare provider. This could be a doctor or a nurse, a psychologist, a pharmacist, or anyone working in healthcare. Decision maker. This could be educators, elected officials, band council members, or healthcare administrators. Researcher. Remember, you only need one person to submit your expression of interest.
If you think you might be interested in being a co-principal investigator, there are a few things to consider. First, co-principal investigators will have increased responsibilities. Second, the project requires a 2-year commitment. Third, all co-principal investigators must primarily reside and/or work in Saskatchewan. And finally, if you're successful, the project will be a team effort, even if you submit an expression of interest independently. As a co-principal investigator, you will share leadership responsibilities with the other co-principal investigators. To Together, the co-principal investigators will keep the project on track and ensure that the necessary reporting takes place, manage the administrative and financial responsibility associated with the $10,000 of financial support, be the primary contact for SCPOR, and facilitate team meetings and ensure training and project targets are met.
Important things to know when submitting an expression of interest. You do not need to have all your team members and/or stakeholders identified at the expression of interest stage, but you should have an idea of how you will engage with patient partners and other stakeholders. The expression of interest is step 1 of 5 in the selection process, and you do not need to have every detail developed to be successful, just as long as you're on the right track and your idea aligns with the priority area. Important things to know when submitting an expression of interest. You can apply for up to $3,000 funding through SPEDA to assist with engaging patient partners and other stakeholders in the application development process. SPEDA stands for Stakeholder and Patient Engagement Application Development Award. SCPOR will also provide support from a patient engagement specialist at this stage. Expense considerations. 2 successful project teams will each receive $10,000 to cover expenses over the 2-year project. This is in addition to any funding they've already received, like SPEDA. Certain elements will impact your budget and should be considered when planning. Examples include honoraria. This is used for engaging traditional knowledge keepers or elders and patient partners. Meeting costs. This is used for travel and food per diems, room rental costs, and parking expenses. And technology. This is used for stakeholders from rural and remote areas who may need technology provided and/or travel covered.
For more details, see SCPOR's Patient-Oriented Research Learning Health System Application Guide or visit scpor.ca/LHS. All right, at the heart of these projects is a patient-oriented research philosophy, which necessitates that patients are equal partners on every team. Next up, we have Heather Dick, a patient partner and member of SCPOR's Patient Partner Advisory Council, among a host of other things. Heather will discuss her experience working as a team member developing a project proposal. I'll turn it over to Heather.
Hello, everyone. Like Chris said, I'm Heather Dick, and I'm a patient partner. I'm involved with SCPOR with the Patient Partner Advisory Council. As well, I sit on the Oversight Committee. I've been involved in the development of the Learning Health System research processes, as well as other opportunities, and I'm involved with research itself. In the SCPOR Learning Health System research call, patients are co-principal investigators and true partners in research. The concept of requiring patient partners as co-PIs is new, but patients as true partners on research teams is not. I've had the privilege of working on research teams where I was a partner on equal footing with all other primary team members, and I'm listed and function as a co-investigator on the team. On one team, the idea for the research topic was decided upon jointly by a few of us. This group got together after working together on another project. We discussed the possibility of applying for a research grant and met to discuss all ideas from all team members. As a patient, I saw a gap in services in my own healthcare journey that fit with the rest of the group's areas of expertise, both clinical and as researchers. Other ideas were also discussed by team members, and as a group, we decided on a research question that mattered to patients, was timely, as the pandemic had started to change how health services could be provided, and had the potential for real system change that would benefit patients, providers, and the health system. The idea decided upon was suggested by me, but the team as a whole conceptualized how it could work, what was involved, who else needed to be on the team, and what the small core team would look like, as well as what a larger stakeholder team should look like. Once all those things had been decided by the group, the team member most familiar with grant writing produced a rough draft, which was circulated to team members, including the patient partner, me. We met to suggest changes, wording, missed pieces, timelines, to name a few, and the final grant proposal was developed. The grant was successful, pending ethics approval, which was also a joint exercise. while relying on individual experiences and areas of expertise to produce the finished project. The larger team was recruited, including a few more members for the core team, including another patient partner, viewed as vital moving forward by the rest of the team. One patient partner didn't provide all of the lived experience that could be applied or could be of benefit to the team, and at least one more needed to be recruited. On this team, I was a partner from the very beginning, and the input of patient partners was expected, encouraged, and had equal weight in decision-making. As a patient partner, I was a true partner involved in the entire process, from the idea to grant writing, ethics submission, survey question writing, data analysis, and interpretation. As the project continues, I and the other patient partner remain as true team members through the rest of the research processes, including knowledge dissemination. It is important that patient or community partners have a particular team member or members to contact with any issues that might arise, and that the rest of the team is willing to help work out details that might come up, such as access to computer programs, time constraints for meetings, or anything else that affects the patient partner's ability to fully integrate with the team. Open, frequent, two-way communication makes an effective team. And to make research applicable, all patients must be empowered to make decisions throughout the project, identifying priorities that are important to them, what outcomes matter to them. Relevant stakeholders with clearly defined roles must be integrated into the research project, and patient partners, whether individuals or communities, and end users must be fully integrated into crafting and implementing the knowledge translation plan. Thanks, Chris.
Thanks, Heather. So finally, I'd like to walk everyone through some key dates. After that, we'll open it up to questions. Once again, feel free to put your questions in the chat or save them for another few minutes. All right, so all these dates are included in the application guide. So if you need additional information about any of them, then you can head there. However, the major milestones or dates are the application package being released, which happened on February 14th. On April 5th, then we'll have the expression of interest submission deadline. On May 5th, then there'll be a notice of expression of interest dictating or outlining who's moving on to the next stage. On September 15th, then the full applications will be due. From September 16th to 30th, then there'll be a compliance review process. On November 1st, successful applicants will be notified. And in November 2022, then support for learning health system projects will begin. That support will conclude in November of 2024, so 2 years later, where SCPOR support for projects will end. So starting with the expression of interest, the application deadline is April 5th, and as noted, the notice of decision is 1 month later on May 5th. The expression of interest form and guide are available on the SCPOR website under the Learning Health System page. The purpose of the expression of interest is to allow applicants to provide an overview of the project they envision, describe how the project fits within the current year's patient-centered research learning health system focus area, which for this year is mental health and addictions, and also explain how different stakeholders can be engaged in the development of an eventual patient-centered research learning health system project proposal. It's not necessary for an applicant to have all the details of their project finalized at this point. They just need to provide basic information about their idea for the project. Expressions of interest are submitted to SCPOR and reviewed by the Learning Health System Council. The Learning Health System Council is the decision-making body for SCPOR's patient-centered research learning health system processes. It includes experts in different areas, including academia, the Saskatchewan health system, patient-centered research, and working with Indigenous communities. Many of these experts are patient partners and Indigenous community members. The Learning Health System Council will select up to 6 projects to move to step 2, the stakeholder engagement phase. When reviewing expressions of interest, the Learning Health System Council will look for similar proposals. If similar projects are identified, it may be suggested that individuals who submitted these proposals work together moving forward, assuming that the proposal includes permission to do this. There will be a checkbox in the expression of interest form to ask permission to make these connections. The Learning Health System Council may also recommend other individuals that would be beneficial to connect with, such as decision makers, researchers, or clinicians who may have an interest in the idea put forward. During the stakeholder engagement phase, teams will be supported to engage with these individuals. After the expression of interest notice, which takes place on May 5th, 6 teams move to the stakeholder engagement phase. The purpose of the stakeholder engagement phase is to bring together a group of stakeholders who have lived experience in the proposed project area. This may include experience with a health issue, providing services, implementing new initiatives, or understanding needs and interventions. Bringing this group together will help applicants better understand all the important aspects of the project put forward in the expression of interest and start to develop a more fulsome vision of their patient-oriented research learning health system project. Teams will receive support from a patient engagement staff member who works for SCPOR and the Saskatchewan Health Authority. This person has expertise in facilitating discussions between various stakeholders, including patient partners, community members, clinicians, decision makers, and researchers. The patient engagement staff member is also available to help applicants plan and facilitate their engagement sessions and ensure everyone's voice is heard. Each project will also receive up to $3,000 to engage with stakeholders through SCPOR's Stakeholder and Patient Engagement Application Development Award, or SPEDA. This funding can be used to pay for different parts of the engagement process, such as patient partner honoraria, travel expenses, food provided at meetings, or technology to help people connect. In the stakeholder engagement phase, teams will start planning which in-kind supports they will utilize in the project and how these supports will be used to complete the project. To ensure teams understand the supports that are available and how they can be best utilized, teams will have the opportunity to meet with SCPOR's facilitation team and data coordination team. The facilitation team will help teams understand and plan to use the skill sets of resources available, such as quality improvement personnel, research scientists, evaluation specialists, knowledge exchange specialists, and a project manager. The data coordination team will help ensure that teams understand the data sets available, data collection methods, and how teams can be supported to access these data sets and use those data collection methods. The data coordination team will also help teams understand and plan to use the skill sets of resources available to them, such as data analysts. Each team will be able to request up to 4 full-time equivalents or FTEs of support per year for the 2-year period. Moving on to important application deadlines and the notice of decision. The application form that teams will need to complete and submit will be provided to the 6 teams that move to the stakeholder engagement phase. Applications will be assessed in 7 areas, which are all noted in the application guide. Successful teams will receive up to 4 full-time equivalents or FTEs of support per year for 2 years. This in-kind support is valued at approximately $900,000. Teams will also be able to access up to $60,000 of trainee support and $10,000 in monetary funding. The deadline for submissions is April 15th. The compliance review will take place from September 16th to 30th, and the notice of decision will occur on November 1st. And then supports will begin sometime in November, with support ending 2 years later in November 2024. Finally, we have some questions that were submitted online, but I'm going to stop sharing my screen and we'll open it up to questions, and we can kind of mix in questions that are going to be asked during this section with the questions that were submitted online. All right, so if you do have a question, feel free to either type it in the chat or put up your hand. To do that, then there's a little reactions button at the bottom of the Zoom box, and up there then there should be a raise hand function, and then we can call on you. Or if you can't get either of those to work, then just feel free to unmute yourself and ask a question. While we're waiting on that, or while we're waiting for more questions to come in, then I'll go to a few that came in previously online. So the first being, it seems like researchers will have an advantage at the expression of interest stage because they work on these kinds of things more often. Is SCPOR doing anything to ensure that patient partners have a chance when it comes to making it through the expression of interest stage? And in response to that, then I just wanted to note that the review process for expressions of interest is still being finalized. However, SCPOR will be taking a number of steps to help ensure that everyone has a fair chance when it comes to making it past the expression of interest phase. Steps include looking at the review process through an equity lens, de-identifying expression of interests before they're provided to reviewers, instructing reviewers to focus on the idea itself and the 3 big questions that are included in the expression of interest form, rather than things like spelling and grammar or other small details, and using a process where expression of interests are not scored, but rather recommended to move on to the next stage based on the 3 posed questions. Do we have any questions from anyone here today, or should I keep going through the questions that were received online? And we do have one in the chat. So it says, thanks. I'm unclear if we are collecting data from existing data collection systems in the health system, or if we can collect new data. So thanks, Colleen. Great question. And we don't specify which. I think that there's opportunities to do each of those. So we do require that projects include patient-reported outcome measures and patient-reported experience measures. If there are systems in place to collect those already, then we don't expect people to, or we don't expect teams to create a new system to collect that kind of information. We recommend that you work within the systems that are already in place to collect it. But there are a lot of places where patient-reported outcome measures and patient-reported experience measures aren't being collected at the moment. And in that case, then teams would work to collect new data. All right, so I'm not seeing any hands raised. So maybe we'll go back to the questions that were submitted online. And the next question that came up was, as a patient partner, I don't even know where to start when it comes to collecting or connecting with clinicians, researchers, and decision makers. Will SCPOR provide support for doing this? And yes, I very much want to reassure everybody that we are working to help do this. So when you submit your expression of interest, then that will go to our Learning Health System Council, and that group will recommend different individuals to connect with who would be appropriate based on the expression of interest put forward. So that would include people like clinicians, researchers, and decision makers. And then we will support teams to connect with those individuals, because I know it can be intimidating reaching out to those kind of people. So we're really there to help make connections. When it comes to connecting with additional patient partners, then we do have our patient researcher connection site, and we'll be supporting teams to post there to help connect with additional patient partners. So really trying to support teams in connecting with all the different stakeholders that are involved in getting these projects developed and applications put forward. All right, maybe we'll continue going through questions that were submitted online because we did get a few. So the next question was, trainee funding is mentioned in the video. Can you explain a SCPOR traineeship? Who is eligible, how they were recruited, and what supports they will receive? And I know that Christine and Maria are here, so I'll turn it over to the two of them to answer some questions.
I can answer the question. So a traineeship is a stipend that can be used to support a trainee, and that trainee is engaged in the LHS project. And an LHS trainee must be a graduate student at the University of Saskatchewan, University of Regina, or Sask Poly, and have their supervisor be a member of the research team as well. And the stipend amount that is offered is up to $30,000 per year for up to 2 years that the selected LHS project will be receiving that funding. And as the goal of a traineeship is to build core capacity in the trainee, they must be engaging with patient partners as well as with the other team members on the LHS team. Did that answer all the questions, Chris?
I think so. Thanks, Maria.
Yeah, thank you.
So there's another question that came in around that, Maria. Do trainees need to be enrolled in an academic training program, for example, an MSc or a PhD?
Hi, Caitlin. Yes, the trainees should be a graduate student, so a master's or PhD student, but that does not include postdocs. So postdocs would be ineligible for a traineeship. Thank you.
All right, we did have a few other questions that came in, so we'll keep answering those. And like I said, if you have questions, then feel free to raise your hand or put them in the chat. So next question was, do you have any tips for completing the SPIDA budget during the expression of interest stage? And I'll turn it over to Michelle, because I know that she's kind of our SPIDA expert.
Thanks, Chris. Yeah, hi. For people who don't know me, my name is Michelle Flowers. I'm from the patient engagement platform. So one of the things that we do is to help support teams if they're building a budget for their patient engagement. So I guess for people who may not have done it before, how do you start? How do you even know how to spend this money? I guess the advice I'd give would be to think about the different stages or parts of the project that you need to sort of design and talk about. Or you may want to just set regular meetings just at a time that works for everybody on your team and address all of the topics as they come. I think the important piece to remember, and that is make sure that you include lots of time for getting to know this team as you're building a lot of pieces for people who may not know each other. Spend lots of time building trust and building that relationship, because it's going to be a core piece of what you're going to be doing over the next couple of years. So when you're looking at, well, how much will this cost in the budget, then you can connect with us for support with regards to how much the policies are or how much the honorary would be for your patient partners. But for each meeting that you have a patient partner there, you need to pay honoraria for their time, just to, I guess, as a token of appreciation and to value their commitment to your team. And of course, if you're the patient partner that's putting in the expression of interest, it's your time as well. So look at the budget and how much work you're able to be putting in. The other thing to think about is if things are opening up, would meeting in person be a really valuable use of your budget? And so you may find a place that's convenient for all of the team members to meet. Do you have to book a meeting room? Do you have to pay travel? Do people have to stay overnight in hotels? What's the meal allowance and the per diem to get there? So those are other things to consider as well, because they can be quite costly for your team, but getting to know each other in person is actually a very valuable use of that money. The other things to think about with regards to the budget is if you're engaging with Indigenous communities and you would like to connect with knowledge keepers or elders, the honoraria that we pay for their engagement is actually at a higher rate. So you need to think about that, and also culturally appropriate gifts. So you want to consider that and include them in your budget. The other things that you might think about are technology. Do people on your team need access to maybe a cell phone or a cell phone plan so that they can connect and attend your virtual meetings? Or technology could be that they need access to a laptop. So think about those things, because they'll be eligible to spend your budget on. Other things that could be expenses that people need might be even childcare, so that people can actually take part in your meetings. All sorts of things can be included. So yeah, I'd say just reach out to us and you can discuss what your plan might be, what you're thinking, and we can help you build that budget. Anyway, thanks for that, Chris.
Thanks, Michelle. And then that kind of ties in with the last question we got online. So if a patient partner wants to submit an expression of interest, but is having difficulty completing the form, is there someone who can assist with that? And I will note that if you're having difficulty completing anything, feel free to reach out to Skipper, and we can just use the general email, so skipper@usas.ca, and we'll make sure that someone gets in touch with you and is able to answer any of your questions, and ensure that everyone's able to get that expression of interest form in, because we really want this to be open and accessible to anyone who's interested in putting forward a project idea. All right, that was all the questions that came in online. Maybe we'll leave it open for 1 or 2 more minutes to see if anybody else has questions that come up. And as noted, feel free just to unmute yourself and ask any questions, or to put them in the chat if you're more comfortable with that. All right, so a new question that came in, is it okay that we have pre-existing relationships with patients, etc., like an established team? And yep, that's completely okay. If you can if you already know enough people that you can fulfill the requirements where we have a researcher, a clinician, a decision maker, and a patient partner co-leading the team, then that's great. We don't expect everyone to have that established already, but that there's no issues if you do, and we will support you if you don't. So happy with teams happy with teams of all makeups when they're starting.
Chris, something that's just coming to mind that might be helpful for people who are listening today who might, again, be new to research, but how is our learning health system, I guess, program and project? How's it different from a traditional, say, research funding opportunity? Can you give the succinct answer there?
Yeah, and that's, you're giving me tough questions, Michelle. I know we cover it a little bit in the videos, how we expect them to be different. I think one of the big differences is that it really does bring together a number of different stakeholders. So rather than being a research project, then we're looking at this as a learning health system project. So a number of different stakeholders co-leading it. And we really see them as being very embedded within the health system. So the various organizations that contribute to health in the province. And then to do that, then we are bringing together a number of different supports from within the health system. SCPORs partners are all contributing different supports to the projects, and those are the supports that will help make the project happen rather than just research funding. So I think that all those things contribute to kind of what makes a learning health system project unique. So there's another question in the chat. So the $60,000 for the trainee funding is provided to the trainee directly from SCPOR rather than being awarded as part of the fund for the successful applicants. And I'll turn it over to Maria or Christine to answer that question as well.
From my understanding, I believe that the stipend is awarded to the supervisor of the trainee. And Christine, is that correct?
Yes.
Okay. Yes. And so I know that, at least in my experience, depending on where the supervisor is, which academic institution they're representing, so the University of Regina, University of Saskatchewan, or Sask Poly, there are different administrative things that they need to do to access that funding. I know it's different between institutions, but SCPOR will provide that stipend to the supervisor, and then that can be distributed in a way that both the supervisor and trainee agree on.
Yeah, and I think just to emphasize there, so the only kind of general monetary funding that teams receive will be the $10,000 of support. There will be that trainee funding as well, and then the $900,000 is all full-time equivalent support or in-kind support. So individuals to join the team and make it happen, which is a little bit unique for these learning health system projects as opposed to kind of your standard research project or research funding opportunity. So next, the question is, can a stakeholder or stakeholders with needed expertise be located outside of Saskatchewan? Would the project be rejected? So thanks, great question. So we do want the different co-PIs to be located in Saskatchewan. We really want these projects focused on Saskatchewan. There is an opportunity for additional team members. So there's the 4 co-PIs, and then there's an opportunity for as many additional team members as you would like. And I think it would be very much okay if some of those additional team members were located from outside the province, but we really want the leads for the project to be located within the province. So another question coming in, with the focus of mental health and addictions, should projects be both of these topic areas in their interaction, or could a project be focused on one of these areas, but not so much the other? For example, mental health without a focus on addiction. And we do allow projects to be focused on mental health or addictions or both. And yeah, so that is outlined in our application guide, but but great question, and can also focus on mental illness as well. So all these different aspects, and it can definitely focus on one specific one or include them all. While we're waiting to see if any additional questions come in, I will note that SCPOR has a frequently asked questions section on our scipor.ca/learning health system page. So any questions that come in regularly or we think would benefit the general public in putting together an application, then they will be posted there. So feel free to check that out to see if there's any other questions that might be relevant that have been asked. And then also feel free to send us questions after this session. Because if other people have similar questions, then we're happy to answer your question and happy to make sure that we share that information to the general public on that FAQ page as well. So another question, what kinds of supports will SCPOR provide for in-kind supports? Would this look like having an RA on a research team, or is there a process according to the application? So our in-kind supports are all listed on our website. There are a number of them, and they're coming from a number of different organizations. So there will be some project management support, some research specialist and research scientist support, some quality improvement support, as well as data analysts and other individuals with those kind of skill sets. So really a wide range of skill sets. We did look through we did do our best to look at what kind of projects or what kind of supports are needed to make this project happen, because we understand it's a little bit different not having a research assistant or research associate as part of the team. And I think that we did a pretty good job of ensuring that we brought enough supports together to cover all the skill sets that standard RA would have, along with a lot of different skill sets and a lot of skill sets that take a lot of expertise to develop, as far as things like data analysis and knowledge translation, just to name a few. So yeah, I'd really encourage you to check out our website at scipor.ca, and I think that from there you should be able to find a section that outlines many of the supports that are provided.
I think with no questions there, I just want to jump in for all the patient partners. They're in the audience. There's been patient partners along the whole trip of designing these application guides. We've done our best to try to make the language accessible, but we know that sometimes it's a big, overwhelming process. Please definitely reach out for that support. We've tried to make sure patient partners can fill in applications and can lead these teams. So if you have that idea and you're just wondering, can I do it? Give it a go. Just reach out for the support that you need. We'd be happy to help.
Thanks, Michelle. Really good point. I will say a big thank you to all the patient partners that have been involved in developing this. There's been a lot of engagement along the way, and I know a lot of people have put a lot of hours into helping us design something that's hopefully very accessible to everyone. All right, so I'll do one final call for questions. As noted, if you think of something later after this session, then feel free to email us, and we're happy to answer any questions. I know this is a new initiative. Takes a little while to kind of get your head wrapped around, or to wrap your head around everything that, or kind of the application as a whole, or the project call as a whole. And we are happy to support everyone along the way.